Hello, I'm Dr. Shuben, core faculty for the College of Health Sciences and Public Policy at Columbia University with the joint faculty appointment at Ross University School of Medicine. And in this video today, I'm going to be talking about respiratory syncytial virus, RSV, you might not know of. And this is a viral etiology of pneumonia. While there's really no treatment for RSV, and usually subsides in 1 to 2 weeks, there's an age group which this targets the most, and by about 2 years of age, many infants and toddlers have had it. So we're going to be talking more about that, especially because there's a rise in the number of cases more recently than we ever have seen before. And what that is being attributed to, I'm going to talk about this later, is the preponderance of COVID-19 and how other respiratory infections had increased because of this virus. Just a quick note about the type of viral attack that takes place with COVID-19. The type of viral attack actually activates the complement pathway within the lungs, causing inflammatory cascade reactions. Again, the age group that mostly affects is 2-year-olds, and some of the other symptoms to look for within an infant. And one of the problems with treating infants is that they can't talk yet, so the only signs that you can go by is expressions and nonverbal communication. So this is a challenge of not only treating but conducting research among this age group. Some of the other symptoms that takes place is runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. So these are symptoms not only that the patient is able to speak on, but something, a lot of these can be determined through process of elimination or determined to seeing if these are a contributory factor. Symptoms goes away 1 to 2 weeks on its own. Definitely don't use viral medications, antiviral medications, because there is none. However, with that said, there is antibiotic prescription, but it's not antibiotic prescription for anything specific to RSV because it's a virus, but many times RSV leads to bacterial pneumonia, and when that takes place, the bacterial pneumonia can easily be treated with antibiotics. So even though the RSV combination might have increased due to COVID-19, the good news is that this is not a lethal virus, but just something to be cautious about, something to keep in mind, and have a high index of suspicion for this disease. Hope all of this makes sense, and thank you for listening. So in this slide, I wanted to go over the epidemiology of RSV. About 2.1 million individuals go into outpatient, which is non-hospitalized, and that's a pretty huge frequency, considering that the people that are affected are toddlers and infants, and so immunity has not developed as much for these individuals. Out of the 2.1 million, there are 58,000 hospitalizations among children younger than 5 years of age, and 177,000 hospitalizations among adults 65 years and older. So on both extremes, this affects not only infants but also people of advanced age. Yale New Haven Children's Hospitals. Overall RSV cases seen in the ED jumped from 57 last week to 106 currently. So quite a huge outbreak that's going on with RSV, and the theory the theory here is that due to COVID pandemic, a lot of individuals lost immunity to keep away RSV and other types of diseases. So ways to prevent acquisition of RSV, of course, we're wondering about that. One thing that's always important is washing your hands frequently. To help young children do this, a lot of people will do the 20-second hand wash, but then not protect children. If soap and water are not available, you can actually use alcohol-based hand sanitizer. This will help protect you from a lot of the RSV germs. Keep your hands away from your face. Avoid touching your eyes, nose, and mouth with unwashed hands. And then avoid close contact with sick people. Avoid close contact, such as kissing and sharing cups or eating utensils with people who have cold-like symptoms. Ways to prevent RSV. Sorry for the errors. Cover your coughs and sneezes. Clean and disinfect surfaces, and staying home when you're asleep. Staying home when you're sick. And this gives you kind of a brief overview for each of them. Let's go with final messages. There have been recent increase in RSV, increased awareness about RSV, and the increase of virus is especially important, and having a high index of suspicion for clinicians and understanding the symptoms of RSV is especially important. Thank you for listening.